Hi everyone, Arun here. Just want to have a quick chat to you today about what to do when a muscle, neck, back, wherever goes into spasm on you suddenly, and what the process is and what's the best way to deal with that straight away. This happened to me just on the weekend, which is what made me think of it. I was doing some exercises, I hadn't warmed up enough, didn't do any breathing first, which is something that I'll talk to you in another video. So what happened was muscle on this left side of my neck just went into a spasm, just kind of cramped up on me, felt very tight. I thought, oh no. Usually what happens, the first thing that you do is your mind goes nuts, starts catastrophizing about, oh, how am I going to do this task? How am I going to get through the day? How am I going to go to work? Whatever it might be. The best thing to do is to really just take a moment, take a deep breath, assess the situation, just assess how bad the pain, the spasm is. And really what's happening is, for whatever reason, your nervous system has decided that it needs to go into protection mode. So it does that, it wants to stop any movement to prevent any further damage from happening, even though it's very unlikely that any damage has actually happened in the first place. It's a very old, wise organism, our mind and our body, and what that's doing is trying to protect us. So our nervous system will lock down in spasm, it'll release some inflammation and make it very painful, very hard to move. But usually if we just take a moment, and what I did was, after the crazy catastrophizing part, I just thought, okay, well, what can I do? What's available to me through my neck? So I brought my head down forward and it was painful. So I thought, okay, well that's not good. I could look up, okay. I thought, okay, well that's good to know. I turned to the left, wasn't too bad, but a bit of a pull. Turned to the right, was quite fine. Same with the sideways, didn't really like going that way. So what I did was straight away I just did some gentle movements and into the ease, into the movements that were actually quite comfortable. And this is telling my nervous system, or it's showing my nervous system, that actually I'm okay. I'm not in danger, it's okay. My sympathetic fight or flight response starts to calm down a little bit. I think actually I do have a bit of movement available to me. I'm going to live. So other things that are really important to do in this situation is really focus on the things that to you that have worked in the past that are comforting, nurturing, soothing to your nervous system. This is really important because that will also help calm down the nervous system response, and it will really lessen the time that muscle will spend in that spasm, because the more that you can convince yourself on a deep level that it's okay, it's safe and not dangerous, the less time that muscle will spend trying to protect you in spasm. And it's really the nervous system that's controlling that. So we want that to calm down, the inflammation to calm down. So the things that work for me is heat. So heat pack, you can pop on there. It was a really hot day, so I decided not to do that. So I just put some cream on. This is physio cream, but I didn't have this at home at the time, so I just used some deep heat. Rubbed it on there, that feels really soothing, nice, takes away the pain sensation for a while. I also really like things like Traumia, which is a homeopathic product, which is just helps with any of the inflammation. It's got things in it like arnica, which helps with the healing process. And just some gentle soft tissue work. I did a little bit of gentle rubbing. You can use like a spiky ball or something just to help ease that tension and again show that it's okay and it's safe. So those are a few things that I did to help initially. It's feeling much better today. I'm still a bit wary of some movements, but I'm still keeping it moving, keep showing myself that it's okay and comforting, and I'm sure I will be out of pain soon. So I hope that was helpful. If you've got any questions, just pop a comment down below and I'll look forward to hearing from you soon. Bye.